It's just like the 3-4 days.
Calgary Dr. Rupinder Tour started a petition last year aimed at federal universal access to free prescription contraception. When news came out on Friday of a federal pharmacare deal that would include full coverage for contraceptives, she was thrilled.
The people who are struggling to afford contraception would struggle to support a child as well. And so I think it really comes down to that, prevention is always going to be cheaper.
A report commissioned by Empower Her found that 83% of Canadians supported universal coverage of contraceptives.
Birth control is not free in Canada, and the cost is a barrier for the most vulnerable in our society.
But in an email to Global News, Alberta's health minister said if the federal government pursues a pharmacare program, Alberta intends to opt out. Adriana Lagrange says the province was not consulted on the pharmacare plan, and there are assumptions that are not taken into consideration that add costs for the provinces. Her office said the vast majority of Albertans have access to contraceptives through employer or government healthcare insurance plans. But Tour says programs are not available to all Albertans and can be patchy and difficult to access. Even with current coverage, she says 40% of pregnancies are unintended, costing an estimated $320 million in Canada and $40 million a year in Alberta.
I think the real question is, why would the government not want to implement this? Do they not want to save the $40 million? Do they not want to make life more affordable for everyday Albertans and help improve the health of maternal and children in this province and help support women to get back into the workforce and let them, choose when they want to have pregnancies?
Poverty reduction advocates say the cost of birth control pills is an issue to low-income Albertans, youth, and newcomers.
So I'd be very curious to see what the alternative is, if it covers the same things, and actually how it would be implemented. Because a lot of people cannot afford right now that upfront investment in order to get medications. And we know that people are skipping medications on a regular basis right now.
The pharmacare deal also includes insulin for type 1 and type 2 diabetes. More details are expected to be released this week. Carolyn Kury de Castillo, Global News.